Do you support universal health care as a right or as a long-term objective? How would you deal with rising health care costs and growing inaccessibility to health care services?
Thank you. Hello? Okay, thank you for that question. What I wouldn't be doing is giving a massive tax cut to the wealthy. So that's number one. So I would be working to reinstate the tax benefits that we need to be able to fund our programs. As I said before, I believe in universal health care. It was one of the things I studied when I was a 19-year-old student at college, and I lived in Costa Rica, where my research project was studying the universal health care system for my certificate in Latin American Studies. And I have always believed that health care is a fundamental right, and it is an imperative in this country. We have an Affordable Care Act. We have a platform that many people in this country believe would work. We have to give it a chance to work, and that is the area that I would spend the majority of my time trying to do, because we have a convergence of agents willing to come to the table, healthcare advocates, AARP, healthcare insurance organizations, hospitals, doctors. We have to sit together to figure this out, but we have to give healthcare to our citizens in this country. The right to life depends on quality of life, and healthcare is the fundamental right that provides that. Thank you.
Ms. Cheryl.
We need to make sure that every single person in this country has quality and affordable health care. There are many ways to do that, but the first thing we need to do is take care of the Affordable Care Act. Because we have seen an administration that is attacking our healthcare system again and again and again. We need to protect the right to have health insurance for pre-existing conditions. We need to make sure we keep the 10 essential benefits. We need to make sure that your child, 26 and under, can be on your health insurance plan. But we also have to work hard to fix our healthcare system. So I think we should have Medicare negotiate for drug prices and save our seniors money. I'm a veteran. They do this in the VA system quite successfully. I also think that we should look at allowing people 55 and older to buy into our Medicare system. These are some of the fixes that could really move our programs forward and cut our health insurance prices. But at the end of the day, we need to sit down and figure out how we are going to make sure each and every person in this country has quality and affordable health care.
Mr. Washburn.
Hi, I'm somebody who is for Medicare for all. I'm concerned about employer-based insurance falling apart, breaking apart. Where I work, I'm a union member. I'm a part of the teachers union. We get raises every year, and more of our health care is we have to cover that cost. And I think big companies, small companies are all saying we don't want to be part of this healthcare business. I also think it's an invisible tax that we all pay. Every time one of my students has to pay their tuition, they're paying for my health insurance. But I'm one of the lucky ones. Most of the people, my college goes for adjuncts because they don't want to pay health coverage. And a lot of other smaller companies, they don't want to pay health coverage. So even though I am for fixing the Affordable Care Act, I think that we need to someday have a conversation with the people and say, do we really want to continue going down this road of employer-based health coverage, or do we want to go to a system where they have in other countries Medicare for all? So that's what I'm in favor of.
Thank you, Mr. Coleman.
Thank you. We as a country have to have only one goal, and that is health care for every citizen at an affordable price. Forget the buzzwords that distract. That is the only goal that we should have. I take health care very personally. I had stage 4 cancer, and when I contacted my insurance carrier, they said, take a look at the book, see what doctors can treat you. I checked all the doctors. One was dead, 2 were breast cancer specialists, none were board certified. I went through the next process and I found a doctor that I thought was qualified. I went through the appeal process and they said, no, that person is not going to be covered. They didn't care whether I died. They just didn't. Stage 4, a matter of days. I know what it feels like when somebody doesn't have insurance and they feel that they're going to die. I am in favor of restoring the Affordable Care Act and having health insurance for every citizen in this country at an affordable price.
Thank you.
Morristown.